Good evening, students. Am I audible? Good evening, students. Am I audible? So, in today's class, we'll solve some MCQs from dental anatomy. So, the first question is the human molar teeth can be categorized as. Human molars can be categorized as. And the options are bunodont, thecodont, heterodont, haplodont, and all of the above. So, what should be the correct answer here? Bunodont, thecodont, heterodont, haplodont, or all of the above? Good evening, students. Can you all hear me? So the human molar tooth can be categorized as. So how can we categorize the human molar teeth? Options are bunodont, thecodont, heterodont, haplodont, and all of the above. Right? So what do you mean by bunodont? Bunodont are those teeth which have rounded cusps and they are used for crushing. Right? They are used for crushing food. Thecodont means those teeth which are anchored by or anchored with the help of a soft tissue lining. For example, human dentition, which is anchored with the help of periodontal ligament. Third is heterodont. Heterodont means, for example, in human dentition, where not all the teeth are of same type. Right? So, heterodont means different types of teeth in a dentition. For example, in human dentition, we have incisors, canine, premolars, and molars. Right? So, human dentition is heterodont. Then what is haplodont? Haplodont means haplo means single. So haplodont means single conical cusp. Right? Single conical cusp. So haplodont, obviously molars cannot be classified as haplodonts. Right? Because canine has a single conical cusp, whereas molars, they have multiple round cusps, isn't it? So haplodont का example तो होगा canine. Again heterodont, the dentition is classified as heterodont or homodont, not a single tooth. So molar can't be classified as heterodont, nor can they be classified as haplodont. Again, thecodont is a classification for dentition. All the teeth will be either thecodont or pleurodont or ecrodont. So it is not a classification for a single tooth. Bunodont, on the other hand, it represents the shape and form of a single tooth, right? If the tooth has rounded cusps, then it is bunodont. And the example of bunodont is molars, human molars. So the correct answer here is option A, that is bunodont. So let's go to the next question. Which of the following has the largest cusp? Now we have to look for the largest cusp, and the options are maxillary canine, mandibular first premolar, maxillary first molar, mesiopalatal cusp, mandibular first molar, mesiobuccal cusp. So what should be the correct answer here? What should be the correct answer here? Now we are not talking about the entire crown. We are talking about a individual cusp. So the molar has, a maxillary first molar has 5 cusps, isn't it? Same mandibular first molar also has 5 cusps, and individually within that tooth, the mesiopalatal cusp is the largest molar cusp, isn't it? It is the largest molar cusp, but it definitely is not the largest cusp in the dentition. So the largest cusp in the dentition would be that of maxillary canine, isn't it? The largest single cusp would be that of maxillary canine. So maxillary canine has a very large cusp, isn't it? Whereas the maxillary molar, in that limited space, it has 3 primary, 1 secondary, and an accessory cusp. That is cusp of Carabelli, right? So it has 5 cusps. Clear? So the correct answer here would be option A, that is maxillary canine. So in the maxillary first molar, the mesiopalatal cusp is the largest cusp, and in mandibular first molar, the mesiobuccal cusp is the largest cusp. So let's go to the next question. क्या बात है, आज कोई रिस्पॉन्ड नहीं कर रहा, कोई जवाब नहीं, कुछ नहीं. So which of the following tooth occludes with a single antagonist tooth? Right? Which of the following tooth occludes with a single antagonist tooth? Say, for example, let's take the upper canine. Right? Let's take the upper canine. So upper canine occludes with the lower canine and the lower first premolar, isn't it? Similarly, the lower first premolar occludes with the upper canine and upper first premolar. So any tooth will occlude at least 2 opposing teeth, isn't it? It will occlude with at least 2 opposing teeth. So which of these following teeth will occlude with only 1 opposing tooth? That is what the question is asking, right? Now the options are mandibular lateral incisor. So mandibular lateral incisor occludes with maxillary central and maxillary lateral. So this can't be the answer, right? Then maxillary central incisor. Maxillary central incisor again occludes with mandibular central and mandibular lateral. Clear? So this also can't be the answer. The third option is mandibular third molar. The mandibular third molar occludes with maxillary third and maxillary second molar. So this also can't be the answer, isn't it? This also can't be the answer. What about maxillary second molar? Can maxillary second molar be the answer? Let's see. Let's say this is the maxillary second molar, right? This is the mandibular second molar and this is the mandibular third molar. So upper second molar occludes with lower second and lower third molar. So even this can't be the answer if we are restricting ourselves just to the permanent teeth. तो अगर हम अपने आप को सिर्फ permanent dentition पे ही restrict कर लेंगे तो ये भी आंसर नहीं होगा. But what if these teeth or this tooth is primary? What if this tooth is primary? In case this tooth is primary, then the third molar will not exist, isn't it? The third molar will not exist. and in that case, the maxillary second molar will occlude with only mandibular second molar if we consider that this maxillary second molar is a primary tooth, isn't it? Now, since nothing is mentioned here, first of all, nothing is mentioned here whether it is a primary tooth or a permanent tooth. Second, we know that mandibular lateral incisor, be it primary or be it permanent, will occlude with both the maxillary central and lateral incisors. Similarly, maxillary central incisor will occlude with mandibular central and lateral, be it primary or permanent. Mandibular third molar definitely is permanent, isn't it? So, we can rule out the top three options whether they are primary or permanent. But the last option can be ruled out only if it is a permanent tooth. But if we consider it as a primary tooth, yes, that is the answer. So, though in the first view, none of these options they appear correct. Yet, when we think about them, the last option is better as compared to the rest of the options, isn't it? So, always remember that solving an MCQ, as I have said countless times, is not about finding the correct answer, isn't it? It is about finding the best option. So, the best option amongst these four, or you can say the least wrong option amongst these four, is option D. And that's why we'll go with option D, that is maxillary second molar, right? So, maxillary second molar यहाँ पर आपका आंसर हो गया. Next is which of the following, which is the only anterior tooth? So, only anterior has to be an anterior tooth with mesiodistal dimension that is greater than cervico-incisal dimension. So, what it means is that the tooth is broader as compared to its cervico-incisal length. So, cervico-incisal length is less as compared to its mesiodistal dimension. So, which tooth are we talking about? Options are primary maxillary central incisor, primary maxillary lateral incisor, permanent maxillary central incisor and permanent maxillary lateral incisor. तो भावना क्या लगता है कौन सा होगा इसका आंसर? Which is the only anterior tooth where the mesiodistal dimension is greater than the cervico-incisal dimension. There is only one anterior tooth with such a feature, and the answer here would be, what would be the answer here? The answer here would be primary maxillary central incisor. So the upper A is the only tooth, right? Upper A is the only tooth to show such a feature, right? Is it clear? So let's go to the next question. अगले क्वेश्चन पे चलते हैं. वेरी गुड भावना, है ना? तो cusp tip of palatal cusp of maxillary first premolar is, so let's say this is the maxillary first premolar and they are talking about its palatal cusp, isn't it? So the palatal cusp of the upper first premolar is, option A is mesial to the midline. So let's say this is the midline, right? Mesial to the midline, distal to the midline, mesiodistally centered and out of occlusion. See, out of occlusion, the palatal cusp that is out of occlusion, there is no such tooth. Rather, the lower first molar has the lingual cusp, which is out of occlusion. So we can rule out option D. Now in first premolar, upper first premolar, we know that for the buccal cusp, the distal cusp ridge is longer as compared to the mesial cusp. Mesial cusp ridge is longer as compared to the distal cusp ridge, isn't it? So when you look at the tooth from the occlusal view, the tooth appears a bit rotated, isn't it? In the upper four buccal cusp, the mesial cusp ridge is longer than the distal cusp ridge. So the tooth appears a bit rotated, isn't it? It appears a bit rotated. Its buccal cusp is centered, right? Its buccal cusp is centered mesiodistally, though it should have been a bit distally placed. So its buccal cusp is centered mesiodistally and its mesial cusp, it's not mesial cusp, it's palatal cusp, and the palatal cusp is Slightly, it appears to be slightly mesially displaced. So when you look at this tooth from the lingual aspect, when you look at this tooth from the lingual aspect, this is how it might appear. This is how it will appear, right? So here this is the buccal cusp and this is the lingual cusp tip. And if you draw the center line, let's say this is the distal, this is the mesial. So the lingual cusp tip, it appears to be passing the, it appears to be placed bit mesially as compared to the center of the tooth, right? So the correct answer here would be option A, that is mesial to the midline. Now let's go to the next question. Is this question clear? The tooth appears to be a bit rotated on its long axis. So which of the following tooth has most variable crown anatomy? Which of the following tooth has most variable crown anatomy? So always remember that when it is about the variable crown anatomy, the upper 8 has the most variable crown anatomy, followed by lower 8, followed by the upper lateral incisor, followed by lower second premolar. Is it clear? And these 4 are given as the option in this question. So the correct answer here would be maxillary third molar. Actually, they are not very tough questions, Bhavna. They are really simple questions. But such questions may be asked. Isn't it? Such questions may be asked. And out of these questions, if I really think about it, maybe this question is a bit tough because here you need to remember certain things, right, about the tooth. But other questions like this 4th question or the 3rd question, they are relatively simpler, isn't it? This is an exception which is the only anterior tooth with a wide crown as compared to its length. So such questions are considered easier ones, isn't it? ये तो अपने को आने ही चाहिए, ठीक है, जो exceptions हैं, right? So let's go to the next question. So here it is just a sequence: upper 8 followed by lower 8, followed by upper 2, followed by lower 5. So that is the sequence for the variable crown anatomy. Which deciduous tooth has the maximum cervico-incisal length? So basically maximum crown length. क्या पूछ रहे हैं यहाँ पर? Maximum crown length. Maximum crown length. So, obviously, the first question also was a bit difficult. That is because I wanted to tell you because that not all options have to be right. Sometimes you have to choose from the wrong options, which is less wrong, isn't it? So that's why I created that first question. Maybe such questions might not be asked in the exam. So which deciduous tooth has maximum cervico-incisal length or maximum crown length? Options are maxillary canine, mandibular canine, maxillary central incisor and maxillary first molar. So always remember, when permanent or primary, nothing is mentioned in the option, right? You will consider them as the permanent tooth. You will consider them as permanent teeth, right? So when nothing is mentioned, whether these teeth are primary or they are permanent, you will consider initially them as permanent teeth. So let's consider them as permanent teeth. So when they are permanent teeth, we know that the tooth with maximum crown length is mandibular canine, isn't it? Mandibular canine. It has a crown length of 11 millimeter, whereas the upper central incisor has a crown length of 10.5 millimeters, and the upper canine has a crown length of 10 millimeters. Isn't it? So the correct answer here would be option B. Very good, Bhavna. That is mandibular canine. तो देखो आता है ना तुम्हें आंसर. So they are relatively easy. So let's go to the next question. Right? When viewed from proximal side, which tooth exhibits a C-shaped facial profile? So when you view the tooth from the proximal side, let's say we have the, let's say it's a anterior tooth, right? So when you view from the proximal side, in the proximal view, its facial outline should make a C-shaped curvature, right? Its facial outline should make a C-shaped curvature. So, which is such tooth? That is the question, right? So, the question is asking which tooth has a C-shaped facial profile when you see it from the proximal side. So, the options are maxillary canine, mandibular canine, maxillary primary first molar, and mandibular primary lateral incisor. So, which should be the correct answer here? So, in case of the mandibular canine, its mesial outline, when you take a look at from the facial surface, you will notice that its mesial outline is straight, and when you take a look at it from the proximal surface, you will notice that its facial outline is almost C-shaped, right? So the correct answer here would be mandibular canine. So remember that from the facial view, its mesial outline is straight, and from the proximal view, its buccal outline is almost C-shaped. Clear? So let's go to the next question. Which tooth is not known as the cornerstone of dental arch, as it divides the dental arch into mesial and distal equal halves, right? So which is known as the cornerstone, and why does it be called a cornerstone? Because it divides the dental arch into mesial and distal equal halves. So which tooth is this? Can you tell me the correct answer here, Bhavna? Options are canines, first molars, second molars, and maxillary first premolar. So which one do you think should be the answer here? So which of these do you think should be the answer here? Is it the canine, is it the first molar, is it the second molar, or is it the maxillary first premolar? Now, do you know why I added this second half of the question? I could have limited this question here itself, isn't it? Which tooth is known as the cornerstone of dental arch? And that would have been sufficient, isn't it? But there was a reason for which I added this second part of the question, isn't it? Bhavna, do you think there is a need to read this second half? We should be reading this second half. We should think about this second half, what it actually means. Do you really think that this dental arch would be divided into mesial? Let's say we demarcate this midline of the arch so that we have a left and a right quadrant, and let's say this is the canine. In front of which we have just the lateral and the central incisor, and behind which we have 2 premolars and 3 molars. Do you really think that the canine would divide this arch into a mesial and a distal equal halves? Do you really think the canine would do that? Isn't it? So it is always absolutely necessary to read and understand the question before answering, isn't it? So the correct answer here would be first molar, isn't it? The correct answer here would be first molar. So the first molar divides the dental arch into a mesial and a distal equal halves. Clear? The canines are also called cornerstones. They are also called cornerstones, but the reason for which they are called cornerstones is different. They are called cornerstones because when you smile, they are seen at the commissures, right? Or they are seen at the corners. So when you smile, they are seen at the corners here, or the commissures, and that is why they are called the cornerstones. So without them, we can't have that proper curvature of the smile, isn't it? So they are very important as far as the aesthetics is concerned, and that is the reason canines are called cornerstones. They are seen at the corners. They are seen at the commissures, right? Whereas molars are called cornerstones because they divide the arch into equal halves. So distal root depression is deeper than mesial in which of these teeth? Distal root depression. So basically, let's say this is a tooth, isn't it? On its mesial side and on its distal side, it will have certain depressions. So these depressions are deeper on the distal root depression. These are deeper on the distal as compared to mesial in which of these teeth? That is the simple question. And the options are mandibular, lateral incisor, maxillary first molar, maxillary first, it should have been first premolar. It should have been first premolar and maxillary central incisor. So where do you think the distal depression is deeper than the mesial, right? So in maxillary central incisor, we usually do not have any root depressions, right? In case of maxillary first premolar, the mesial depression. In case of maxillary first premolar, the mesial depression is more prominent as compared to the distal depression. As far as maxillary first molar is concerned, we can easily rule it out. Why can we rule it out? Because the maxillary first molar has 3 roots, and in the options we haven't mentioned the root, isn't it? So we do not know which root we are talking about. And even if the mesiobuccal root had been mentioned or distobuccal root had been mentioned, the mesial root depression would have been more prominent, isn't it? So even if the roots were mentioned, even then this would be an incorrect option. So the correct option here would be option A, that is mandibular lateral incisor. So even if you didn't know whether the maxillary first molar or the mandibular first molar, they had a deeper mesial depression or a deeper distal depression, we can easily rule them out. Why? Because the root is not mentioned, the individual root is not mentioned in the option. So if we convert this option C, instead of maxillary first premolar, let's say we call it mandibular first molar, even then we can rule it out. Because the specific root, whether it's the mesial root or the distal root, is not mentioned in the options, right? So option A, that is mandibular lateral incisor, is the correct answer here. The mesial cusp ridge is longer than the distal cusp ridge as a rule, right? But the exception to this rule is, so which of the following is the exception to this rule? That is the distal cusp ridge. And this question has been framed a bit incorrectly. Here it should be distal cusp ridge and here it should be mesial cusp ridge, right? So the distal cusp ridge is longer than the mesial cusp ridge as a rule, but the exception to this rule is, that is, the mesial cusp ridge should be longer than distal cusp ridge. So which tooth has mesial cusp ridge longer than the distal cusp ridge? And the options are maxillary canine, maxillary second premolar, mandibular first premolar and maxillary primary canine. So I have told you in the class the answer to this question, isn't it? तो क्या आंसर होगा इसका? Which is the only exception where the mesial cusp ridge is longer than the distal cusp ridge? In the primary maxillary canine and in maxillary first premolar, isn't it? So these are the only two teeth where the mesial cusp ridge is longer than the distal cusp ridge. So maxillary primary canine is the answer here, right? Is it clear? The distal cusp ridge is longer than the mesial cusp ridge and that is the rule. So the exception to this rule is maxillary primary canine or maxillary first premolar. Which of the following statements regarding mandibular primary first molar is true? So mandibular primary first molar, right? Mandibular primary first molar. Which statement is true? And the options are, the cervicoincisal crown length is greater on the mesiobuccal half as compared to the distobuccal half. So what it means is, let's say this is the tooth and this is how it appears, right? So this is the mesial side, this is the distal side. So as you can see, the cervicoincisal dimension is greater on the mesial side as compared to the distal side. This is the buccal view, isn't it? So the cervicoincisal dimension is greater on the mesial side. So yes, this statement is correct. The mesial outline of the crown is a straight line. So as you can see here, the mesial outline is indeed a straight line. So option B is also correct. The mesial marginal ridge resembles a cusp. So as you can see here, this cusp-like elevation, that in reality is the mesial marginal ridge. So mesial marginal ridge indeed resembles like a cusp. So the correct answer would be option D, that is all of the above. Is it clear? भावना क्या है, समझ में आया? So the mesial marginal ridge indeed resembles a cusp, and the mesial outline of the crown also has a straight line, and the crown length is greater on the mesial half as compared to the distal half. So let's go to the next question. In a patient, high points were noticed in the buccal half of the first molar region. So let's say this is the first molar. So this is the lingual side, this is the buccal side. Now where is the interference noted? So high points were noticed in the buccal half of the first molar region in centric. So in centric, in the buccal half, an interference was noted. Can it be compared with premolar? Which tooth? The mandibular first deciduous molar? No, it cannot be compared with a premolar. It is the maxillary first deciduous molar which looks like a premolar, right? It is the maxillary first deciduous molar that looks like a premolar because its distal half is less developed or underdeveloped, isn't it? So upper D resembles a premolar because its distal half is underdeveloped. So there is an interference on the buccal half in the centric and in the non-working contacts as well. So not just the centric, there is an interference in the non-working contact as well, right? So the question is, which of the following would you reduce to relieve the high points? So options are maxillary central fossa. So where is the maxillary central fossa? This is the maxillary central fossa. So option B says maxillary central fossa and supporting cusp. So maxillary central fossa, and this is the supporting cusp. Option C says mandibular supporting cusp. So this is the mandibular supporting cusp, isn't it? And option D says mandibular supporting cusp and maxillary central fossa here. So which of these four do you think should be the correct answer? Which of these do you think is the correct answer? Which of these should we reduce to relieve this high point? Should it be the maxillary central fossa, or should it be the maxillary central fossa and the supporting cusp both? Or should it be the mandibular supporting cusp? Which of these would you like to reduce? Option D is mandibular supporting cusp and maxillary central fossa. इनमें से किसको reduce करेंगे अपन ताकि interference खत्म हो जाए? बताओ किसको reduce करें? See, if you just reduce the maxillary central fossa, the interference on the non-working side will not be resolved, and hence this is of no use to us, right? If we reduce just the maxillary central fossa, and supporting cusp, that's not the answer, Bhavna. The answer has to be one amongst these four options, isn't it? In non-working, we reduce the supporting cusp. I know that, isn't it? But that is not in the option. In options, we have four simple statements saying option A, that reduce maxillary central fossa or reduce maxillary central fossa and supporting cusp, mandibular supporting cusp or mandibular supporting cusp and maxillary central fossa. So your answer has to be one of these, right? Option B is maxillary central fossa and supporting cusp. So if we reduce the maxillary central fossa and the maxillary supporting cusp, then the interference on the centric and in the non-working both will be resolved, isn't it? Both will be resolved. So this seems to be a correct answer. But then let's check the other options as well. Mandibular supporting cusp. So if you reduce the mandibular supporting cusp here, if you reduce the mandibular supporting cusp, then the interference in the centric is resolved and the interference in non-working is also resolved. So both options B and C, they help in resolving the interference in both centric and non-working contacts, right? What about option D? That is mandibular supporting and maxillary central fossa. So if we reduce the mandibular supporting and maxillary central fossa, it might reduce the interference in one of these, right? It might reduce the interference here and it might also help in reducing the interference here, isn't it? Why? Because when we are reducing both of these, then the amount of reduction done on the cusp might be less. So it may or may not help in resolving the interference in this non-working contact. But let's say we have resolved the interference even with the option D, right? Let's say we have resolved the interference even with the option D. So now we have three options which are helping us in resolving this interference, isn't it? So which of these three do you think is the best? Which of these three do you think is the best? Now as a rule, we also need to check. Once you have checked the interference in centric and non-working, you also need to check the interference in the working contact, isn't it? You also need to check the interference in the working contact, isn't it? And the basic rule is that we should try to preserve the occlusal contacts, isn't it? We should try to preserve the occlusal contacts. So yes, with the maxillary central fossa and supporting cusp, we are indeed able to relieve these interferences. But what we are doing is, we are trimming this fossa and we are also trimming the supporting cusp. So when we trim the supporting cusp, obviously there might be an opening of occlusion on the lingual side. When we reduce the supporting cusp on the mandible, then we are again reducing the interference, but then we might be opening the occlusion on the buccal half. So occlusion in any case is partially lost, isn't it? Occlusion in any case is partially lost in the working side movement, isn't it? So when the occlusion is partially lost with any of these options, then why not choose the option where we are saving most of the tooth structure, isn't it? So here we are also reducing the central fossa and the supporting cusp, but in the option C, we are just reducing the supporting cusp and preserving the fossa. Is it clear? Since we are losing the occlusion partially in all of these three options, better go with the option where we are at least preserving some tooth structure. So mandibular supporting cusp, reducing it alone is the best option amongst these three. Is it clear? Is it clear? Is it clear, students? Had there been a fifth option, maxillary supporting cusp, what do you think about this maxillary supporting cusp? Reducing the maxillary supporting cusp, do you think it will help us in resolving both of these interferences? Do you think it will help us in resolving both of these interferences? It might help us in resolving the non-working side interference, but it has no role in the centric interference or interference in the centric occlusion. So option E would be incorrect. Is it clear? So let's go to the next question. The maxillary third molar with a palatal cusp and two buccal cusps is made up of how many lobes, or is made from how many lobes? So basically it's a three-cusped premolar, isn't it? It's a three-cusped premolar. It's a three-cusped premolar. So you have two lingual and one buccal cusp, isn't it? So for molars and for anteriors, remember that the buccal surface is made up of, or the facial surface is made up of 3 lobes. And the lingual surface, remember the rule that 1 lobe per cusp. So if there is a single cusp, it is made up of single lobe. If there are 2 cusps, it is made up of 2 lobes. So here, as you can see, sorry, it is the third molar. I am very sorry. Instead of the third molar, somehow I read it as premolar. So reading the question and understanding is very important if you want to answer the question correctly. Otherwise, though we know the correct concept, we will end up marking the incorrect answer, right? So maxillary third molar with a palatal cusp and 2 buccal cusps. So though I knew the concept correctly, what I did was I was totally wrong because I had started drawing the incorrect tooth. So here we have 2 buccal cusps and 1 palatal cusp. So in molars, the rule is simple, that 1 lobe per cusp. So be it any molar, it's simple that 1 cusp will be made up of 1 lobe. But then there is another rule which says that minimum 4 lobes are needed for any tooth, right? So there has to be a minimum of 4 lobes to form a tooth, and in molars 1 lobe will form 1 cusp. And the thing is that here we have just 3 cusps. So according to this rule, the tooth can be made up of only 3 lobes. But then we have this second rule which says no, there should be 4 lobes. So in reality, what happens is that this palatal cusp, it represents the fusion of mesiopalatal and distopalatal cusps, isn't it? The distopalatal cusp, this is the secondary cusp, right? This is the secondary cusp, and as we move from first molar to second to third molar, the reduction in the size of distopalatal cusp is drastic. It reduces more as compared to the other cusps. So it is either insignificant or it merges with the mesiopalatal cusp. So therefore we can see only 1 cusp because it has fused with the mesiopalatal cusp. And that's why the correct answer here would be option C, that is 4 lobes, because the mesiopalatal and distopalatal both cusps were present. It's just that they fused to form the single palatal cusp. So there were 4 cusps, but 2 of them fused to form a single cusp, and therefore minimum of 4 lobes are present here. That is the correct answer. Is it clear? So next is, a child was exposed to high levels of fluoride for 1 month at the age of about 2 years. So age 2 years, exposure 1 month, right? Which of the following teeth do you think have least chances of getting involved? So this question is based on chronology, isn't it? So 2 years, 1 month, that is the age of the child, isn't it? So the exposure is from 2 to 2.1 years. So let's say maxillary first molar. When does the maxillary first molar start to develop? It starts to develop at birth, right? It starts to develop at birth, and from then on it completes at 2.5 to 3 years, isn't it? So during the exposure, the tooth is still forming. So yes, it will be exposed. Mandibular lateral incisor, it initiates in the first year, and from then on it continues to develop till 4 to 5 years of age. So this too will be exposed, isn't it? What about maxillary first premolar? Maxillary first premolar initiates in the second year, and from then on it continues to develop till 5 to 6 years. So even this would be slightly exposed, isn't it? The cusp tips of the maxillary first premolar would be exposed, isn't it? Because it has started to develop in the second year. So the cusp tips would be exposed. Cusp tip, or you can say the occlusal third, it would be exposed. What about the mandibular second molar? Mandibular second molar develops in the second half of the third year. That is 2.5 to 3 years of age. So by 2.5 years, the exposure was over, isn't it? The exposure was over. So it started to develop after the exposure was over or after the exposure ceased. So mandibular second molar would be least affected or it will not be affected. Clear? So it has the least chances of getting involved. In the next question, it is based on the previous question, right? So in the above question, where the exposure was from 2 years to 2 year 1 month, isn't it? The hypoplastic defect is closer to incisal or occlusal surface in which of the following teeth? Now we have to see which tooth started to form during this period of exposure. So maxillary central incisor. Now maxillary central incisor, let's say this is the maxillary central incisor. It initiated at about 6 months. Yes, though it initiated at about 3 to 4 months, you can even write that. Or if you don't remember, you can just write 6 months, and it completes at about 4 to 5 years. So here the exposure would be somewhere at the junction of incisal and middle third, isn't it? The hypoplastic defect would be somewhere at the junction of incisal and middle third. What about the mandibular second premolar? Let's say this is the mandibular second premolar. Now this mandibular second premolar, it initiates in the first half of the third year. That is, it initiates at about 2 point, or you can say 214 to 234, and it completes at about 6 to 7 years, isn't it? What about the maxillary second molar? The maxillary second molar, it initiates at about 2 to 2.25, and it completes at about the same age, that is 6 to 7 years. And mandibular central incisor, same as maxillary central incisor, would initiate at 3 to 4 months and would complete at 4 to 5 years, isn't it? So in which of these teeth do you think the hypoplastic defect would be most incisal or most occlusal? It would be more incisal or more occlusal. Now remember that the exposure has occurred at 2 to 2.1, isn't it? Between the age of 2 years and 2 years 1 month. So during 2 years 1 month, the mandibular premolar has not yet started to form. So it might not even be affected. But what about the maxillary second premolar? The maxillary second premolar, it may have started at the 2 years of age. So the defect might appear at its cusp tip, isn't it? So amongst these 4 teeth, the tooth where this defect would be most incisal is maxillary second premolar. Is it clear? Is it clear? In the maxillary second molar, the defect would be most incisal. क्या आपको यह समझ में आया? So these questions were based on the chronology of the dentition. Next question, which is the smallest cusp in maxillary second molar? So let's say this is the maxillary second molar, and we don't need to draw an inaccurate tooth, isn't it? So let's say this is the maxillary second molar, this is the mesial, this is the distal side, right? This is the lingual and this is the buccal side. So which is the largest tooth? This is the mesiolingual, followed by mesiobuccal, then distobuccal, and distolingual is the smallest tooth. So distolingual or distopalatal. So the correct answer here would be again option D, that is distopalatal cusp is the smallest cusp in maxillary second molar. But had it been the maxillary first molar, then mesial, lingual, distal and buccal. So had it been the maxillary first molar, then again mesiolingual would be the largest, followed by mesiobuccal, then mesiopalatal, and then distolingual and distobuccal. So distobuccal would be the smallest in maxillary first molar, and if the cusp of Carabelli is present, then that would be the smaller, isn't it? So in maxillary first molar, distobuccal is smallest, But if cusp of Caribou is present, then that would be the smallest cusp. Whereas in second molar or third molar, it is the distopalatal cusp that is the smallest cusp, right? So let's go to the next question. What is the average duration of a chewing stroke? So this you just have to remember that the average duration of a chewing stroke is approximately 0.7 seconds. So duration of the chewing stroke is 0.7 seconds. This we just need to remember, right? Is it clear, Bhavna? So let's go to the next question. The occlusal outline of permanent mandibular first molar can be described as permanent mandibular first molar. So this is the occlusal outline of mandibular first molar, right? And as you can see, the outline is approximately pentagonal, isn't it? So here the correct answer would be pentagonal. Now it is pentagonal because this distal cusp is distally placed or is placed on the distal surface, right? It is more on the distal surface. But what if this cusp is more towards the buccal surface? If this cusp is more towards the buccal surface, then the tooth would appear something like this, isn't it? It would appear something like this. And then we can describe its anatomy as, trapezoidal, right? Then we can describe its anatomy as trapezoid. And if this distal cusp is very less developed or it is underdeveloped, then the anatomy or the shape of the occlusal surface would become rectangular. So the best option is always pentagonal. If pentagonal is not there in the options, we'll go with trapezoid, and if trapezoid is also not there in the options, then we'll go with rectangular. Clear? So pentagonal is the best choice. Pentagonal is the best choice, followed by trapezoid, followed by rectangular. The proximal outline of mandibular first premolar may be described as. So this is how the mandibular posterior teeth will appear. Right? This is how the mandibular posterior teeth will appear. So be it first premolar or any other premolar or molar, they will all appear to be bent towards the lingual surface, isn't it? They will all appear to be bent towards the lingual side. And as you can see, their shape, it appears more or less rhomboidal, right? Its shape appears more or less rhomboidal. So in the mandible, the proximal view of the posteriors, it appears rhomboidal, but in maxillary, the proximal view of the posteriors will appear trapezoid with the broader side towards the gingiva, right? With the broader side towards the gingiva. This is the maxillary posterior proximal, and this is mandibular posterior proximal. So the correct answer here would be rhomboid shaped. Is it clear? So the correct answer here would be option C, that is rhomboid. So with that, we have completed today's questions. Is there any doubt? क्या कुछ पूछना है? क्या आप कुछ पूछना चाहोगे? Do you want to ask anything? तो आई होप कि कोई डाउट नहीं है और ये 20 क्वेश्चंस आपको अच्छे से समझ में आए. सो ऑल द बेस्ट. अच्छे से पढ़ो, खूब सारे क्वेश्चन सॉल्व करो, right? Try to solve as many MCQs as possible, and always remember that we need to read the question properly, completely and carefully. Right? We need to understand the question carefully. Question नहीं समझेंगे तो चाहे कितना भी आपको कंसेप्ट क्लियर हो, we will end up with a wrong answer. Right? जैसा कि हमारे साथ अभी पीछे हुआ भी. तो though we know the concept, we will end up with a wrong answer if we do not read the question properly. So always make sure to read the question carefully. अपने आप ही जो आंसर है वो थोड़ा बहुत आसान हो जाएगा. Right? So